Strong patient, public and stakeholder engagement to improve people's health is one of the main aims of clinical commissioning groups. In one of the most challenging areas of the country, the North East, no less than 3 CCGs have come together to plan and commission health services. The Newcastle and Gateshead Alliance are working with patients, the public, healthcare providers, councils and voluntary groups to create a better future for all. Robin Ross reports.
Parts of the North East are faced with one of the highest levels of social and economic deprivation in the country. There's heart disease, stroke, cancer, obesity and a growing elderly and ethnic population. This is why 3 clinical commissioning groups have joined forces to share their knowledge to plan and commission services. Together they are called Newcastle and Gateshead Alliance. It's early days, but it's going well.
It's a team is what it is, and we've spent a lot of time thinking about the best way to work together and the best way to bring all of our different and diverse skills to the table to do the very best that we can in terms of making quick and nimble decisions.
It actually feels though we've been able to bring the community, our patients, as well as our council colleagues really together to try and say, look, we've got a limited pot of money, how are we actually going to do something good about it?
The Alliance brings together patients, the public and stakeholders. Susie is a health quality checker. She visits GP surgeries and gives feedback on their services for people with disabilities. Susie had a difficult upbringing and still can't believe she's now advising doctors. Today she recites a poem of her very own to show her thanks for finally being heard.
I wondered why it had to be that all my life no one loved me, no one to care, no one to see, no one to listen properly. But now my second life began and you chance to live life through my son. So now I'll tell you I've got a voice, I've got a right to make a choice. I refuse to take that abuse anymore. Yes, I refuse to take that abuse anymore.
It's really good. Started by Newcastle North and East CCG in partnership with Skills for People, the project has now been wholeheartedly supported by the Practices Board to be rolled out across all GP surgeries.
The health quality checkers, I think it's really just opened up the practice's ideas and thoughts around what services we can provide for all patients, so not just your routine patients, but for everybody.
At this patients' forum, some members shared their experience of an informal observational walkabout at a local hospital. Today, senior members of the hospital team are here to listen to feedback and answer questions.
It's a challenge to have 40-odd people in one room, all with their own stories and experiences, but actually I think it's only right and proper we listen to them, and it actually adds value to the commissioning intentions discussion.
We have to get to the hard to reach, and we can't do that without the help of the voluntary sector. So we have a really strong, vibrant community and voluntary sector in the West of Newcastle, and they bring to us so much intelligence and so much connectivity to people who we wouldn't otherwise be able to look after.
Tracy Atkinson started working at her practice aged 16 as a receptionist.
Hello girls.
She's now practice manager. She's seen 5 generations pass through these doors and knew they didn't like filling in scary forms. So she asked them to put their thoughts on paper leaves. Patients loved it and it led to a new X-ray facility.
We'll have a better communication of patients' protocols, working with CCG to develop care plans, developing the clinic and pathways, and I always feel now that we are almost working as we, instead of PCT days where it was us and them.
Each day, millions of people use the NHS. Sometimes it doesn't go right, but the Alliance wants to understand why and avoid it happening again. When one woman shared her unhappiness with the CCG about the care her husband had received, Chris Piercy arranged for her to meet with the hospital. From listening to her story, the hospital now use this example as a training video to share with staff.
It helped her to talk to staff in the trust, so the staff can unpick that and see what they might do differently in future and how to improve that experience and prevent that happening to other people coming through that hospital.
Newcastle Gateshead Alliance believes it's already improving the lives of people.
Yes, intensely challenging, enormously hard work, but at the moment we're all doing that and we're all managing because we are enjoying the challenge.